Welcome to the Idea Exchange, the podcast where we swap knowledge, share perspectives, and explore new ideas on various health topics. I'm your host, Wes Piri, and our guest is.
Vincent Chilemba.
I'm excited to facilitate this exchange of ideas with you. In our first episode, we are discussing a critical health issues that affect millions of people worldwide. That is high blood pressure, also known as hypertension. High blood pressure is a complex condition that requires multifaceted approach. That's why we are bringing together expert insight, personal experiences, and practical advice to help you better understand and manage this condition. Join me and my guest, Vincent Chilemba, a renowned expert in the field of cardiology, who will share his knowledge and expertise on high blood pressure. Together, we will explore the latest research, treatment options, and lifestyle changes that can help you take control of your blood pressure and reduce your risk of related health problems. Welcome.
Thank you.
What is high blood pressure?
All right, so before defining what high blood pressure is, I would like to define what blood pressure is. So, blood pressure is the pressure that blood exerts onto the blood vessels. So, it is presented using two figures, the systolic blood pressure and the diastolic blood pressure. The two figures correlate with the state of the heart movement. So when the heart is actively pumping blood and when the heart is relaxed. Yeah. So high blood pressure is when the pressure that is exerted by the blood onto the vessels is higher. It's higher systolic, more than 130 millimeters of mercury, and diastolic of more than 80 millimeters of mercury.
What causes high blood pressure and what puts individuals at a risk of developing high blood pressure?
All right, so to explore the causes of high blood pressure, it would be easier to group types of high blood pressure. So we have two main types of high blood pressure. There is type 1, which is primary or essential high blood pressure, and group 2, which is secondary. So group 1, the primary high blood pressure, is the most common, which affects about 80% of individuals. And this one doesn't have a particular cause. Whilst type 2, which is secondary high blood pressure, it is correlated to another underlying disease condition. This can be a renal disease, a disease affecting the kidneys, can be cardiovascular diseases affecting the blood vessels and the heart, and can also be due to endocrine causes. So these would be diseases that affect hormonal balances. For the causes of high blood pressure, in short, it can be primarily, which does not have a particular cause, or secondarily, which can be mainly from uh, disease with the kidney, disease with the heart and the blood vessels, and uh, diseases affecting hormonal balances. Yeah. So that's how I can summarize the causes of high blood pressure.
All right. What are the symptoms of high blood pressure and how is it diagnosed?
Usually, patients with high blood pressure are asymptomatic. This means they do not present with any particular signs and symptoms correlating to high blood pressure. Usually, they come to the hospital with another complaint, and uh, high blood pressure is discovered as they are getting their vitals checked. But some some patients with high blood pressure would present with a headache, uh, excessive sweating, and high blood pressure can also change the level of consciousness. So some of the patient can present with these signs and symptoms, but most of the times they usually come with another complaint, and high blood pressure can be found coincidentally. Yeah. So to reach a diagnosis of high blood pressure, uh, it is required to have at least 2 to 3 high blood pressure readings, and these readings should be taken uh, on at least 2 to 3 occasions. So you check the first time and see that the blood pressure is high. You check another time, and yeah, you check another time as well. If the high blood pressure is consistently high on these occasions, at least 2 or 3, you now do physical examinations and lab tests to explore other causes of high blood pressure. So, in short, for diagnosis, you need to have multiple tests done on several occasions, and you also do laboratory tests and investigations, and also physical examinations. Yeah.
How does high blood pressure affect the body?
Um, so high blood pressure mainly affects the blood vessels. So it causes damage to the blood vessels, and this can affect the body differently. For example, it can cause damage to the kidney, and this will present as some kidney diseases. It can also cause damage to the vessels in the eye, can cause damage to the vessels in around the heart. So it depends on the size of the affected vessels. Yeah. So that's mainly how blood pressure affects the body. That's by damaging the blood vessels.
All right. What are the medications are used to treat high blood pressure and how do they work?
All right. So firstly, I'll just mention the groups of medication that are used. Then I'll explain how each and every group works. So we have diuretics. We have sympathetic drugs. We have calcium channel blockers. We have angiotensin converting enzyme inhibitors, and we have angiotensin antagonist. So I will explain how drugs from each and every group work. So I'll start with drugs from the group of diuretics. So diuretics are drugs that act on the kidney, and they'll increase loss of water through urine. So when someone loses water, it reduces the volume of blood. So with reduced volume of blood, there's also an effect on blood pressure. That's it reduces the blood pressure. So these drugs will cause someone to lose more water through urination, and in turn it will reduce the volume of blood, and in turn it will reduce blood pressure. The second group is sympathetic drugs. So these are drugs that act uh, directly on the heart and the vessels. They act by inhibiting sympathetic stimulation from the brain. So, sympathetic stimulation from the brain on the heart, they stimulate the heart to pump harder. They stimulate the heart to increase the intensity of the contractions. So this increase in intensity will increase high blood pressure, will increase blood pressure, causing it to be high. So sympathetic drugs will inhibit the sympathetic stimulation on the heart. So inhibiting sympathetic stimulation on the heart will reduce the intensity of the heart contractions. So in turn reducing blood pressure. They also reduce sympathetic stimulation on some of the vessels, which causes the vessels to dilate. So inhibiting these vessels causes them to dilate. So dilated when vessels dilate, there is an effect on blood pressure, which is reduced blood pressure. So another group would be calcium channel blockers. These drugs mainly work on vessels, and they encourage vasodilatation. Vasodilatation is just expansion of the cavity of the vessels. So with extended vessel cavities, there's a reduced effect on blood pressure. Another group will be angiotensin antagonists. These these drugs they will inhibit the activity of angiotensin hormone. So angiotensin hormone is one of the hormones that are involved in causing vessels to constrict, causing the rumen or the cavity or the vessels to be narrower. So inhibiting angiotensin uh, will, will, will discourage the narrowing of vessels. So yeah, that will prevent increase in blood pressure. The same as angiotensin inhibit angiotensin converting enzyme inhibitors. These also work against vasoconstriction, just as angiotensin antagonist. Yeah. So in summary, those are the drugs that can be used to treat hypertension or high blood pressure. I did not mention the specific drugs in each and every category because there are just so many. So yeah.
What is the role of lifestyle changes in managing high blood pressure?
All right. So on top of the medical interventions on high blood pressure, like the drugs, uh, as part of the management, some lifestyle changes can also be implemented. No, can also be implemented. Some lifestyle changes are implemented to help manage high blood pressure. So blood pressure is mostly a disease of lifestyle. So lifestyle choices would most some of the lifestyle choices have a direct impact on high blood pressure. So as part of the management, uh, we encourage the patients to change lifestyles that can increase the severity of uh, high blood pressure, or that put them at risk of developing high blood pressure. So these lifestyle changes would be reducing salt intake, uh, stop smoking, uh, exercising regularly, managing weight, and avoid excessive consumption of alcohol. Yeah.
How does diet impact high blood pressure and what foods should be avoided?
High blood pressure is associated with obesity. That is the state of being overweight, and weight gain is directly linked to diet. So, in short, diet has an impact on uh, blood pressure. So, to avoid high blood pressure, someone should avoid eating food with excessive salt, and they should also modulate their diet so that they should not become obese. They should modulate on what food they eat and how much they eat, so that they should manage their weight and avoid uh, being obese and later on developing hyperpressure. Yeah.
What is the impact of exercise on high blood pressure and what types of exercise are recommended?
All right. So, uh, regular exercises reduces the risk of developing high blood pressure in individuals who have normal blood pressure. So, leg exercises reduces the risk of developing high blood pressure by promoting wellness, by encouraging weight management, by increasing cardiovascular system efficiency, and it can also help to manage stress. So on the types of exercises that I can recommend to help manage high blood pressure or to help prevent high blood pressure would be exercise from the category of cardio exercises. So these include jogging, cycling, and brisk walking. These exercises encourages uh, what the heart to pump more effectively, and this can reduce the risk of developing high blood pressure. They can also help in managing weight, which is also correlated to developing high blood pressure. Yeah.
How does stress affect high blood pressure, and what stress reducing techniques can help?
So, persistent psychological and physiological stress is thought to contribute to high blood pressure, as it promotes the release of hormones that can directly affect the regulation of blood pressure. So, stress when stress affects these hormones, they can in turn cause increase in blood pressure. And to avoid stress, one can implement multiple techniques, which can include going for therapy, exploring hobbies, sports and exercises, and talking to someone and asking for help. Yeah.
How does high blood pressure affect different populations, such as children and other adults?
So high blood pressure is not so common among children, especially the primary type. Yeah, secondary is common, but yeah. So it affects these populations differently. Since children usually have high blood pressure from another condition like Leno disease, uh, another cardiovascular disease, they present with complications that are associated with those particular diseases, and the impact on lifestyle and well-being is higher in children when children develop high blood pressure than in adults. Uh, Another thing for adults who have primary hypertension, they might not necessarily have signs and symptoms correlating to high blood pressure, so they're not affected as much. And unlike adults who might have secondary hypertension. So these adults who have hypertension from an underlying cause and might have uh, complications from those particular causes that can affect their wellness and state of well-being. Yeah.
How how can high blood pressure be prevented, and what are the benefits of early detection?
So, as I've mentioned before, that their uh, lifestyle lifestyles that increase the risk of one getting high blood pressure. So to prevent high blood pressure, one just needs to change these lifestyles. So as I mentioned before, to reduce the risk of developing high blood pressure, these are the lifestyle modifications someone can implement. So reducing salt intake, stopping smoking, uh, regular regular exercises, managing weight, and avoid excessive consumption of alcohol. On early detection, uh, so early detection and treatment can reduce the risk of developing complications. So when someone presents early, when the blood pressure hasn't gone so far and hasn't caused any damage to other organs, the response to treatment is fairly good, and these particular individuals are less likely to develop complications. So that's how uh, early detection is helpful in the management of high blood pressure.
Uh, what are the challenges and barriers to managing high blood pressure, and how can they be overcome?
So the major challenge I think is lack of awareness. So most people in the communities, they do not know what uh, high blood pressure is, how someone can end up with high blood pressure, and how it can be managed. And another challenge is uh, uh, compliance to medical interventions. So this is specific to individuals who have been diagnosed with high blood pressure. So some of the individuals they might choose not to take the advices that has been given to them, and some even choose not to take the medication that has been given to them. And another challenge is also social and society norms, especially on weight management. In some of our societies, it is seen as a privilege for someone to have more weight. So there are challenges on getting patients and people at least to manage their weight. So to overcome these challenges, uh, the main strategy would be increasing awareness, making people aware of the dangers of hypertension, the lease, and the management of hypertension. So this will increase um, the compliance in medical interventions, and also can help to change the social and society norms.
How can community support individuals with high blood pressure?
So uh, communities can support uh, people with high blood pressure by providing a conducive environment for their treatment and lifestyle modifications. So this will be allowing easy access to healthy facilities, specifically uh, high blood pressure clinics, and also facilities like gyms and uh, learning arenas where people can go and exercise. Also encouraging them to go through lifestyle modifications. So as communities, we can encourage uh, each other on uh, lifestyle modifications. So you can encourage the patients on changes that have been normalized in the communities, like maybe being overweight. So you can encourage them that that's not how these things should be. And another support that a community can implement is setting up community health campaigns and clubs. So through these healthy campaigns, you can increase awareness and also change the attitude towards uh, high blood pressure and uh, management strategies surrounding it.
How does high blood pressure affect daily life, and what accommodation can be made?
All right. So since most of the cases of high blood pressure do not show symptoms, it doesn't necessarily affect their daily life. But for people who might have complications such as stroke due to persistent high blood pressure, it might affect their quality of life, maybe through uh, muscle wasting and cognitive impairment. So, to accommodate these particular individuals, we should create environments which are safe to people, which are safe for people who have physical and mental impairments to be in. So this can include including wheelchair accessible facilities in our infrastructures, just to mention one.
What are the benefits and risk of monitoring blood pressure at home?
So monitoring blood pressure at home is mostly beneficial. So for the benefits, it can allow uh, early detection of high blood pressure. So people who have access to equipment that can be used to check their blood pressure levels, they can be aware of the blood pressure levels sooner and seek medical interventions. It can also uh, uh, make management and follow up of patients easy. So since the patient can check in low time on how they are progressing with their treatment, it makes it easy to organize follow-ups and checkups. Can also increase awareness, as the people who have access to equipment that can be used to check uh, blood pressure levels, they can use such equipment to to teach people around them on how the equipment works and on blood pressure and high blood pressure in general. On the list, I think the major challenge with checking monitoring blood pressure at home would be maybe inaccurate results due to lack of expertise and operator's error. So these inaccuracies can affect uh, both detection and management of blood pressure.
What message would you like to convey to our listeners about high blood pressure awareness and management?
So the main message I would like our listeners to take is that high blood pressure is preventable, can be prevented through lifestyle modifications, and it can also be treated. And there is higher success rates and lesser complications if the treatment has been started sooner. So I would encourage them to seek uh, uh, hypertension, to seek healthy care facilities that can aid in early detection of high blood pressure and to initiate treatment as soon as the a diagnosis is made.
All right, thanks for your time.
Thank you.